Hey guys, and welcome to How to Gastro. So in today's video, we'll be exploring what is an HbA1c blood test. So before we get into the specifics of the HbA1c test itself, let's explore what you can expect when your doctor orders an HbA1c test for you. So the HbA1c test is a simple blood test that can be done at your closest laboratory. No special preparation is needed for the HbA1c test, which means you don't have to fast, so you can eat and drink as usual before the test is done. So during the test, a blood sample will be collected from you, which means a needle will be inserted into a vein, which is usually in your arm, to draw out some blood into an EDTA or purple top blood tube. This blood tube is then sent to a laboratory where it is analyzed to measure the percentage of glycated hemoglobin, or the HbA1c, in your blood sample. So what is HbA1c and what is a HbA1c blood test? So first let's explore what is HbA1c. So HbA1c, or hemoglobin A1c, is a form of hemoglobin that is chemically linked to glucose or sugar in the body. When glucose circulates in our blood, some of it naturally binds to hemoglobin, forming glycated hemoglobin, or HbA1c. This means the more glucose you have in your blood, the higher the amount of the HbA1c will be. So if we had to take a closer look at this little picture here, we see the red blood cell with all the hemoglobin molecules attached to it. And then we see all the glucose. So you'll see that in high levels of HbA1c, we have more glucose attached to those red blood cells or hemoglobin molecules. And in a low HbA1c, we have fewer or less glucose molecules attached. So what is an HbA1c blood test? So the HbA1c blood test, also known as the hemoglobin A1c or glycated hemoglobin test, is a blood test that measures the average level of blood sugar or glucose over the past 3 months. So it is commonly used in the medical field to diagnose and to monitor diabetes. So why 3 months, you might be asking? This is because the average lifespan of a red blood cell is about 120 days, which is roughly around 3 months. So moving along, let's talk a little bit about the normal and abnormal HbA1c levels. So the HbA1c result is expressed as a percentage because it represents the proportion of hemoglobin molecules in the blood that have glucose attached to them. So normal levels or optimal levels will be anything below 5.7%, which is in this green zone here. In levels of prediabetes, we have 5.7% to 6.4%. This means patients who are borderline diabetes or in the process of developing full-blown diabetes. So you'll see here they fall into the yellow zone or the elevated zone. And then higher levels, or this purple zone, is anything above 6.4, 6.5% or higher. So as we mentioned in the previous slide, higher HbA1c levels indicate poorer blood sugar control, which can increase the risk of complications associated with diabetes, such as heart disease, kidney damage, and nerve damage. So very, very low HbA1c levels can be seen in people with shortened red blood cell lifespans, such as in patients with glucose 6-phosphatase, dehydrogenase deficiency, sickle cell disease, or any other condition causing premature red blood cell death. So those patients will have a very low HbA1c. So why is the HbA1c blood test so important? So as we've mentioned, the HbA1c blood test can help us in the diagnosis of diabetes. So a high HbA1c level can be used to diagnose diabetes or a pre-diabetes case, as we saw in the previous slide. The HbA1c blood test is also important for diabetes management So it helps the doctor assess how well a person's blood sugar levels are being controlled over time and can help to guide adjustments in treatment. So let's go back to the previous slide. So if we have a patient that comes into us and we find that their HbA1c level is 5.9, for example, and they fall in the yellow range right here, we start them on diabetes medication. Over a few months, at least 3 to 4 months, that HbA1c level should start to drop, meaning that there's better control of blood sugar. And that will also help us to determine whether the medication is suitable in controlling the patient's prediabetes or diabetes in real life. So the HbA1c blood test is also important because it's a long-term indicator. So unlike daily blood sugar tests, the HbA1c provides an average of blood glucose levels over the past 2 to 3 months, which offers a more comprehensive view of glucose control. So if your patient says, no, they've been staying away from sugary treats and high carbohydrate treats, and they've been taking their medication religiously, the HbA1c levels should be somewhat normal. But if it's still in those yellow or purple zones, which means it's elevated or high, we know that they've been having a lot more cheat days over the last few weeks than they're actually fessing up to. And that brings us to the end of this video. So thank you guys so much for watching. So as we have just seen, the HbA1c blood test is a crucial tool for managing diabetes as it helps in adjusting treatment plans to achieve better blood sugar control. So please remember to like, comment, subscribe, and share this video with some of your friends in the medical community who you think may find this video useful. You can also share it with any of your friends who suffer from diabetes or who go for regular HbA1c blood tests. Take care and have a great day further. Bye for now.